Good morning, everyone, and welcome to our platform at AIS and Surya Ayurveda once again to share some understanding about another part of our body. Today we are going to share about our joints and how we can look after them and what problem come up in our joint and why those problems come up. So this is something we are going to discuss. And everyone very much understand that our movements, if we talk about our knee joints and ankles, and then when we talk about our hands and elbows and your shoulder, every joint is important in our day-to-day life, and all our functions, movement, holding, moving our joint and arms, every joint is important for the functioning of the limbs. And at the same time, we all understand that in our day-to-day life, these are the particular organs or joint which actually get used a lot than any other thing. Yes, every organ keep doing its job in our body, but sometimes you can't see them, whether it is heart, whether it is lungs, but every organ is performing its particular function, and that function can only be achieved if we look after them in a right way. And this science which we are talking today about, Ayurvedic medicine, it has clearly given us the message from thousands of years ago that to look after your body, the key factors are our lifestyle, diet, mental, emotional factors. And coming back to the joint, again, if you will see, whenever we have a bit more erratic lifestyle, excessive use of any particular joint, and then not looking after them in a correct way, what will happen? There will be wear and tears anyway, right? So that's a very natural, obvious part. And then when the wear and tear happening and bodily intelligence is already corrupt because of my lifestyle and because of incompatible diet, then what will happen? Then the natural support system in the joint will get affected. And what is the support system in the joints is our ligaments, our tendons, muscles, cartilage in the joint and around the joint. So flexibility of the cartilage, tendons, ligament, when it get affected, joint will not be able to perform its job properly, and it will start giving you discomfort. And those discomforts will be stiffness, tightness, pain will come up. And that will result in the form of inflammation, or the cartilage will start wearing, which is the tough tissue, and giving a sort of support and the spongy part to the bones in that joint. Then what we do? Normally we do nothing. Reason is, we all know, very easy way. Next morning I have to call my GP and get an appointment, and GP going to advise you that yes, time is now, you can start anti-inflammatory and your pain will get better, and that's how you always see anyway. So initially when you are waking up and feeling a little bit stiff and tight and you feel some pain but bearable, then you might take 2 Panadol and carry on. But after a while, when those Panadols are not working And that's where the first focus will be to go to see my GP, and GP will give you anti-inflammatory part. And then if that after 6 months or so not getting much, he or she might refer you to an orthopedic surgeon, and or now more specific rheumatologist specialist, or all those different specialist role comes up, and they are going to again give you the same sort of approach, same answer, but in a much more specific language and the specific way of prescribing you different painkillers or anti-inflammatories or more other kind of medicine. And then suddenly one start thinking, okay, I need to look at what are the other ways, because nowadays social media make everyone so much aware that they want to do the role of a doctor themselves. And it's no harm in that, because the problem is our doctors will not all the time going to give you, even you keep asking. First of all, many of us will never ask anyway our specialist or GP that is there any side effect to this drug which you are giving. And even if it get asked, they will say you can refer to the booklet what it is there in the medicine which I have prescribed. And you know, when you have to read, you have to use those magnifying lens to read those 320 pages. So mostly we try to go and look at Google and social media and find out what kind of side effect that medicine might have. And then when you know that, okay, there are some side effects, for a while it start giving you a bit of heart flutter, and then people start thinking, okay, hang on, I need to look at what are the other ways I can keep my joints in right state, or how and where I can find some supplement and use them. And when we start looking at, either I will take the shelter of a naturopath, herbal medicine practitioner, or even going to a medical doctor who is following alternative system of medicine, integrated medicine, these are all the terms, functional medicine practitioner. That is what these all current situation medical doctors are doing their practice and trying to prescribe different kind of supplement. And now when you look at those supplements, what those supplements have, for the last 50-60 years, if you pick up since then and even today, the supplement, either you go to health shop yourself or go to these practitioners, the supplements which are prescribed to you are dominated by the glucosamine, one part, then that another supplement will be which will have chondroitin part, right? Then some supplement will be with the shark cartilage, fish oil. So something without even asking, without even thinking that what this supplement actually doing to my joint. Now if we look at glucosamine, right, what it is? It is a joint fluid, right, which is supporting our cartilage, and it's as I mentioned already, tough tissue and support the act as a spongy part. Then our chondroitin is another fluid which is in the joint and support our cartilage, ligament, tendons. So we feel that yes, these are the two major components in my joint which are getting affected. And then what I will do, I will replace them with these capsules which are containing that major ingredient and feel, yes, it will solve my problem. But anyone, either I'm going to say address to the public part or to the practitioner. And again, the same question is, if you are practicing a conscious health practice where your focus is to some extent help and support your client, then you always able to observe that whatever has been prescribed to them, either glucosamine or chondroitin cartilage or fish cartilage or this shark cartilage or fish oil, that person, till the day they keep taking, somehow in their mind, in their brain, pseudo effect is coming up that I'm getting better, right? My inflammation is getting better, my pain and stiffness is getting better. Because this is not something I'm talking about. If you look at, there has been so much studies, clinical trial, even the lab studies, researches about the impact of these both kind of product. And it has been now clinically also very well established that what we talk about, that glucosamine will reduce the damage to the cartilage and repair it and rebuild it. That is nothing been found in those clinical trial. And when I'm talking about clinical trial, they will be always done as a double-blind test, right, with the placebo, and then this one to one group, and then the other group will be given our mainstream drugs. So that is something we all need to understand. But then on the top of that, part comes up that we never even look into that from where this glucosamine or chondroitin is coming up. They all are sourced from the animal source, right? All these seafood part is what will produce you these one. And even in your capsules, again you will see those all capsule will say suitable for vegan and vegetarian, because they are talking about the shell of the capsule. But inside they have all that animal product. So people who consider that they are vegetarian, they are not using animal products and other things, they need to sit back and think that what exactly they have been using. That is the one part. Second is those who consume so much of fish, so much of seafood, shrimps or other kind of thing, they need to think that if these two major components in the supplement are coming from the source of these fish, the seafood, how come that I am using these seafood for such a long time, whole my life, right? So why I am getting the problem, and how these products now in the capsule are going to help me? That is something should be asked by people who are using, and then should be asked by those practitioners who are prescribing this product to their client. So that is one aspect which we need to understand. Then the question comes up, is there any other solution? Because that is what public is doing, that they go to their GP or specialist, they don't want to use those medicine because they found that they have a side effect, complication, right? Then they look at the supplements which are all dominant, whatever company is, they will be preparing those kind of supplement with those ingredients. So question comes up, what else is available to me? Nothing, right? But that is where the point of difference I'm going to share. Now, you all don't need to feel disappointed. One science which has been around with us for thousands of years, and the major component in that science is the herbs, which has been used to protect your joint, helping to stop the wear and tear and repair them. Because again, the principle of these Ayurvedic herbs are not acting as a supplement. They act as a repair work, helping to remove the core cause which is damaging these two components which are supporting our joint, and then also reducing all the free radical substances which are getting built due to our erratic lifestyle and the diet and other components. And I'm sure all different kind of practitioner or doctor, they all understand that this wear and tear and the damage to the joint is happening due to the free radical substances which get formed. So in that light, what are the herbs which has been used in our ancient science? One of them is Boswellia serrata, known as Shalaki. And now, again, my question to all the naturopath and herbalist or medical doctor is that if you pick up the product what you are using nowadays, 90% all these medical or not all medical, basically all these companies who are preparing these kind of supplements, so-called natural supplements, they have started using Boswellia serrata now, right? Because as I mentioned in my previous talks also, and which is nothing wrong in that the Ayurvedic herbs are getting more and more well known to the herbalist or naturopath, and they are understanding that how much therapeutic benefit these herbs has, rather than using such kind of supplement or such kind of ingredient which are just giving as a symptomatic solution and not correcting the problem, and hence the client has to keep using. So when we talk about Boswellia, what exactly this is? This is known for its best anti-inflammatory quality, and hence works effectively for rheumatoid arthritis issues. And not only in the rheumatoid arthritis, it also takes inflammation from the body, so it is impacting the other areas, whether it relates with the gut, IBS issues or some other component. And Boswellia serrata's regular use help to prevent the loss of the cartilage, so that help it to build up its repair work known as. Now, because in our Western concept, or even with the Western herbalists, they will use these herbs, but because, and it is again something not required, that they won't have the understanding on the Ayurvedic principle of that how these herbs work based on the three biological humors, what we call as doshas. So they don't need to even know that. So they always rely on the information given by the scientists on doing the research in the labs, which is important part. And because all these scientists, all the researchers, what they do is they try to drive what are the active constituents in that herb. And then based on those, they will know that what kind of characteristics and the impact and the function that active constituent will have. Now, in Boswellia acid is the main component, which apart from other active constituents is known for its specific action on the leukodrin, which is in the body causing the inflammation. So it keep helping to prevent the increase of leukodrin in the body. That's the way it works. And then it has an analgesic impact also. And as I mentioned, it also has an hepatoprotective qualities. So that's the way this Boswellia herb is used. But then at the same time, and this is not something I'm talking from our Ayurvedic aspect, all these researches what has been done on Boswellia, all the scientists who have done that research, they have very well established that Boswellia serrata will never work if you are not using it in the correct dose, and the correct dose given by them is 1.5 gram. Whereas most of the product which now coming from these all herbal companies, they have used Boswellia serrata, right? And then they're still incorporating other ingredient, because that is how they're trying to make their products now, that everything is being covered. But then if you look at the dosages, that dosage nowhere near that dosages which has been given by all these our scientists. So that's what they need to question themselves, that while they do agree on those researches and then trying to use the product or the herb, but why not in the right dose? And then even for the public who is now trying to look toward the product which has an Boswellia serrata, that you must look at that product which has a right dosage. So this is one herb I'm talking about. But again, in Ayurveda, we always talk about that when we are using any kind of herbs for any specific ailment, Ayurvedic herbs will never work on a single level. They work only with the synergy of the herbs, and synergy of the herbs, as shared before, is where the few different herbs which has a specific action on that particular organ, and in this case it is related with the joint, and working on together, their synergy make that product will be always potent. So when you are looking at what are the other herbs has been prescribed, there is another one which we call a Cedrus deodara, which has an active constituent as a volatile oil, apart from terpenoids and flavonoids and steroids. It has an sterol, right? And that oil is known for its anti-inflammatory, analgesic quality, the best pain reliever, right? And that is how it actually does the job. From Ayurvedic perspective, it is the best on the Vata intelligent and the Kapha intelligent. So all that excess of the synovial fluid which can make the joint movement a bit more restrictive, it will work and keep that synovial fluid consistency in the right form, because that is how the inflammation comes up. So when that excessive fluid is coming up in the joint, so what will happen? The flow of the blood, circulation of the blood will get hampered, and that blood will start getting stagnated in the joint and lead to the inflammation because of the heat component in the blood. So that's a simple principle for someone to understand. Then there is another herb known as Vitex nirgundi, which is one of the best Ayurvedic herb for the nerve pain. So when the pain is coming, definitely it's related with the nervous system. And when the nerves conductions are getting hampered, intense pain comes up, and intense pain will further create more and more complication, and inflammations start building up. And this Vitex nirgundi also have an active constituent which is known as nugarodonoside, right? Which again various flavonoids, phenols and terpenoids are in that particular, alkaloids are there. So that is how this particular herb works. But from Ayurvedic perspective, it is one of the best Vata balancing herb. So that also has a role in the joint issue with the pain and the inflammation. Then there is one specific herb which all of you nowadays know about, turmeric. Turmeric is known for its antiviral, antiseptic, anti-inflammatory and analgesic quality. And that is the reason that also is combined whenever you are making a formulation for joint problem. Then there is another very specific herb which in Ayurveda gets used as a kitchen herb, but ginger, right? I'm sure every one of you understand about the ginger's quality. Best pain reliever, best analgesic. Then there is another herb known as Terminalia chabula, which is haritaki, which has a much more antioxidant quality, rejuvenating quality, so it's help in the repair work of the joint and all the muscles, ligament, tendons and cartilage. So these ways, this product, means all the herbs I'm talking about, they become in a very potent combination. And now someone will think that, okay, where I should find these all the herbs and how I have to use. That is where I'm going to talk to you about one of the product in Ayurveda, right, known as bone tone. This product has all the ingredients which I just shared with you, including Boswellia serrata, Vitex nirgundi, Cedrus deodar, then the turmeric, then your ginger, and then Terminalia chabula. So this product, bone tone, is again, as I shared many times, one question mark in the public and one question mark in the doctors and naturopaths especially, and then the herbalists always comes up. They do want to use Ayurvedic herbs, but then they always will question that the quality of those herbs, efficacy is based on that knowledge part, and then always they question that these herbs might have a heavy metal and all that part. So to mitigate all those fears or anxieties related with the Ayurvedic herb, this particular product is made in Australia, and it is made in Australia in a GMP certified company by the TGA. So what that means is this is a third party product, nothing to do with my involvement in that. My role is only that I made a formulation and got this formulation approved by the ARTG, and it has a licensed number by the TGA, so it's a licensed product, but then made by the TGA certified company. So all the tests on heavy metal, all the morphological tests are done by them. So you can rely on all the qualities controlled by the TGA. I'm sure everyone who is in Australia and New Zealand, they understand, even the Western, all world, whether we go to the USA or UK and like that, yes, they do rely on the FDA's part, but now FDA also has accepted this, that TGA's approved products are much better as far as the quality control and part. And as far as the efficacy of this formulation, I can give my guarantee. For the last 45 years, I have used this product on thousands and thousands of people who come with the rheumatoid arthritis, osteoarthritis, and different pain of the different intensities and movements, difficulties in the joint, and when they have used this product, it helps. But the most point of difference is when you use this product, it will correct the problem rather than just have to carry on using. And if you understand that yes, certain changes I have to make in my diet and lifestyle, it will always give you such long-lasting benefit. Then another thing comes up. We all know in a simple physiology and simple pathology and simple understanding that when my ligament, muscle, joints are getting stiff and tight, yes, the herbs will help to correct the core cause, what it making it stiff and tight, right? But on a immediate way, how I can mitigate that stiffness, tightness, which is making my joints movement restricted, and the bones, holding the bones in their right position is getting affected, and that's where the more pain and pressures will start coming up. So to eradicate that, there is a one very specific oil in the Ayurveda range, also known as Arthi oil. This oil, you just take small amount and every night you rub on any of the joint gently, right, and go to bed. And if you can use a hot water bottle or wheat bag, it will help to enhance the action. But then someone say that, okay, hang on, I don't need this Arthi oil because I'm using an Voltron cream or like that. That is another part I would like to share here very briefly, that those creams, if you will see how they work, they are known as a pain reliever, but how they act as a pain reliever, all those ingredients in the Voltron cream or other pain reliever cream, you will see all ingredients are what we call as cold quality. What that cold quality means, it numb the pain, numb the nerves, and hence the pain relief. But problem is, when you are using it, you get a temporary relief of the pain, but at the same time the cold quality will impact on the nerves function, and hence it can create more and more complication down the track, because that problem will be further impacting on your ligaments, tendons and joint muscles around the joint, and then you will never get a solution which can be long lasting. Whereas if you will look at it, this particular Arthi oil, and if I have to talk about all the ingredients, they are all warming oil, warming quality. So what that means is, when you have applied that, it helps to bring up the counter the stiffness, tightness in those muscles, ligament deep down, and then bringing the circulation without interruption and release all the pain impact, because pain is a trapping component. So when the trap of the nervous conduction get affected, that's where the pain will come, and hence immediate relief, but at the same time no further damage to your joints. So that's why this bone tone and Arthi oil works wonder for your joint. So if you are concerned about your health and about the health of your joint, whatever joint, hand, knee joint, difficulty even in the hip joints and ankle, elbow, and if you are having a now frozen shoulder, that product is something you can rely on, because these products will help to correct the core cause and make your joint better, and not let them to go to that stage that you have to do the replacement of that. So your health is in your hand. You must make a right decision. Yes, I do understand that you have to rely on those kind of products which were having glucosamine and other component, because there was nothing out in the market which you can trust and which you can rely. But now people in the Western world, in Australia and New Zealand, don't need to rely on those kind of products. You have the option available with you, and if you have used those kind of products for 10 years, 15 years for your problem, I will say even use this product for 6 months. If you will see, within 3 months your pain will be changing like anything. I will give you my personal guarantee. You can always call me. I'm based in New Zealand. I have my college in Australia, and we have our online store in Australia. You can either email, you can phone me on 006421913625. You can email me to Dr. Ajit at planetayurveda.co.nz. I'm happy to answer any question, any concern. If you have used that oil and use this capsules, and you feel that my pain or my improvement in joint has not happened, I will be responsible. So let's use these products. Let these products play a role in your well-being, and then that's how Ayurveda can help. And the same message for my practitioners of different modalities and in the Ayurvedic practitioner, that we must look after our client for their well-being, and give them the right advice and use the right product so that you can also have a peace of mind. Thank you.